What's up, beautiful people? Another day, another study. If I was a grifter, I would use this type of study to sell you probiotics or an oral detox program or cleanse program or whatever, but I'm not. So I'm just going to report this because I find it interesting. We talk about chronic pain a lot because I'm a chronic pain sufferer. We know that people who have chronic pain usually report lower quality of life, poor sleep, more stress, anxiety, physical limitations. And because of those things, there may be an increased risk of other chronic diseases. And recently, the gut brain axis has been thought to be involved in chronic sensitization disorders, things like migraines, which I have, fibromyalgia, which I probably have, IBS, which I have, and I've definitely had TMJ before. And these sensitization disorders are actually pretty prevalent in my family, so there's probably some type of genetic trigger there for us. Now, this study examined self-reported oral health, looked at the oral microbiome and associations with migraines, functional abdominal pain, and body pain in women. And overall, they found that lower oral health scores were correlated with higher scores on migraine, fibromyalgia, and functional bowel pain. In fact, participants with higher oral health scores had a 5% reduced risk of experiencing frequent migraines and an 8% reduced risk of chronic migraines. And then they noticed various changes through the microbiome with the different sensitization syndromes. Overall, though, a higher prevalence and abundance of commensal organisms usually means that both sides benefit. So both the bacteria and us as the host, in this case, benefit. They were found in participants with higher oral health scores and lower pain scores. And possible mechanisms for link between the oral microbiome and pain signaling could be from changes in signaling molecules, changes in growth factors and neurotransmitters from alterations in the oral microbiome. There may also be an increase in bacterial toxins, specifically called LPS, and these things are known to induce inflammation. And it's thought that the bacterial metabolites reach distant sites via venous and lymphatic drainage. Now, this was a self-reported observational study, small sample size, a single gender in New Zealand. There's a lack of well-defined oral microbiome health criteria, and this was not an intervention study. But in my personal life, and why I found this interesting is I found improvements in like my IBS and pain when I get dental cleanings. And I notice a flare up of these things when it's been about 5 or 6 months between cleanings. So has anybody else noticed that in their life, that they feel better in these certain areas after a dental cleaning? Let me know down below. And I'll keep an eye on studies, hopefully intervention studies, looking at improving oral microbiome health and chronic pain.